Hello, I'm Dr. Alan Mercer. In 35 years of practicing family medicine, I've noticed something that stays with me. Some of the sickest patients I've ever treated had one thing in common. Their bodies tried to warn them, quietly, at night, long before anything dramatic happened, and almost every single time, they told me the same thing afterward. They thought it was just getting older. Here's what I want you to understand right from the start. Most serious illnesses don't begin with a dramatic collapse or a sudden, unmistakable pain. More often, they begin as a whisper, a small change in your sleep, a symptom you notice for a few seconds and then forget about by morning. These quiet nighttime signals can show up weeks, months, sometimes even years before a condition becomes obvious. And because they're subtle, they're easy to dismiss. Now, I want to be very clear about something before we go any further. Noticing one of these signs does not mean something bad is definitely happening to you. Most of the time, there's a simple, harmless explanation. But recognizing these signs early can mean having an earlier conversation with your physician, and in some cases, that timing matters more than people realize. Today, I'm going to walk you through 8 nighttime warning signs I've seen come up again and again in my practice. And I'll tell you now, the 8th one is the one I worry about the most, because it's the one where people most often wait until morning, when waiting simply isn't the safe choice. Stay with me, because by the end of this video, you'll know exactly what to watch for and exactly when it's time to call your doctor. Let's begin. The first sign is waking up gasping for air. Maybe it happens rarely, or maybe your spouse has mentioned that you seem to stop breathing for a few seconds at a time during the night. Sometimes this is related to acid reflux, and sometimes it's simple anxiety. But one of the most common underlying causes in adults past 60 is obstructive sleep apnea, a condition where the airway becomes partially blocked during sleep, briefly cutting off airflow. Sleep apnea is associated with more than just poor sleep. Over time, it can be connected to high blood pressure, irregular heart rhythms, and daytime exhaustion that quietly affects memory and concentration. Here's where many people make a dangerous assumption. They assume loud snoring and restless nights are simply part of getting older, so they never mention it to their doctor. I think of a patient I'll call Walter, 72 years old, still mowing his own lawn every week. He came in because his wife was worried. She said he'd wake up several times a night almost choking, and during the day he was so exhausted he'd fallen asleep at the kitchen table more than once. After a sleep study, we discovered moderate sleep apnea. Once he began treatment with a sleep specialist, his energy improved, and some of his blood pressure numbers improved along with it. Walter's case is a good example of something dismissed as ordinary aging turning out to be a manageable condition once it was properly evaluated. The second sign is chest pressure or unusual discomfort during the night. Many people explain this away as indigestion, and often that's exactly what it is. A large meal too close to bedtime or acid reflux can absolutely cause a burning or tight feeling in the chest. But chest discomfort at night can also be associated with underlying heart conditions, including coronary artery disease. What makes this tricky is that in older adults, and especially in women, heart-related discomfort doesn't always feel like the crushing pain we see in movies. It can feel like pressure, tightness, or a dull ache that comes and goes. If you notice chest discomfort that's new, that doesn't clearly match your usual reflux pattern, or that comes with shortness of breath, sweating, or pain radiating into the arm or jaw, that's something to discuss with your physician, and if it's sudden or severe, it may require urgent attention. The third sign is sudden shortness of breath while lying flat, something doctors call orthopnea. You feel fine sitting up, but the moment you lie down, you feel like you can't quite catch your breath, and you find yourself reaching for an extra pillow just to feel comfortable. This can be related to simple congestion or allergies, but it can also be associated with heart failure, a condition where the heart isn't pumping as efficiently as it should, allowing fluid to build up in the lungs when you lie down. But what happened to my next patient surprised even his own family. I'll call him Harold, 75 years old, who mentioned almost in passing that he'd been sleeping propped up on 3 pillows for months because lying flat left him breathless. His family assumed it was just his old age catching up with him. An evaluation revealed early heart failure, and with proper management from his cardiologist, Harold was able to stay active and involved with his grandchildren for years afterward. His story is a good reminder that a change as small as needing an extra pillow can be worth mentioning to your doctor. The fourth sign is one many seniors think is completely normal, waking up repeatedly through the night to urinate far more than usual. Doctors call this nocturia, and yes, an aging bladder can be part of the picture, but frequent nighttime urination can also be associated with an enlarged prostate in men, poorly controlled diabetes in both men and women, kidney conditions, heart disease, or even the timing of certain blood pressure medications. One conversation changed the way I explain this to patients forever. A woman I'll call Dorothy, 78 years old, sharp as anyone I've met, mentioned she was getting up 5 or 6 times a night and had been for months. She assumed it was just part of getting older. Blood work revealed significantly elevated blood sugar, and further testing confirmed type 2 diabetes that had likely been developing quietly for some time. Catching it then gave her the chance to work with her doctor on a management plan before complications developed. The fifth sign is persistent night sweats without an obvious explanation. A warm bedroom or heavy blankets can certainly cause this, and for many people, that's the whole story. But persistent night sweats, especially drenching enough to require changing your sheets, can sometimes be associated with infections, certain medication side effects, thyroid conditions, or other underlying issues that deserve evaluation. This is one of those symptoms where context matters enormously, which is exactly why a conversation with your physician, rather than searching your symptoms online, is the right next step. The sixth sign involves the legs, one-sided swelling, severe calf pain, or sudden swelling that seems to come out of nowhere. An ordinary muscle cramp that resolves in a minute or two is usually harmless, but swelling in one leg that develops suddenly, especially with warmth, redness, or tenderness in the calf, can be associated with a blood clot, and that requires prompt evaluation because of the risk that a clot could travel to the lungs. I think of a patient I'll call Robert, 69, who assumed he'd simply strained his calf doing yard work. Because the swelling was one-sided and wasn't improving, he came in and an ultrasound confirmed a deep vein blood clot. Because it was caught and treated promptly, he avoided what could have become a far more serious complication. The next warning sign is one I never ignore, and it's the 7th on our list. Sudden confusion, slurred speech, facial drooping, weakness on one side, or sudden vision changes during the night. If you or a loved one notice any of these, this can be associated with a stroke, and it requires calling emergency services immediately. This is never a symptom to wait out until morning. Time matters enormously with stroke care, and getting help within the first few hours can make a meaningful difference in recovery. And now, the 8th sign, the one I mentioned at the very beginning, and the one I worry about most: loud snoring combined with overwhelming daytime fatigue. On its own, snoring is often dismissed as an annoyance to a spouse rather than a medical clue. But when it's paired with waking up feeling unrefreshed, falling asleep during ordinary daytime activities, or serious trouble concentrating, it deserves a conversation with your physician who may recommend a sleep evaluation. The reason this one worries me is the pattern I see so often. People notice it for years, sometimes decades, and simply adjust their lives around it rather than having it evaluated, all while the underlying strain on the heart and body continues quietly in the background. I think of a patient I'll call Eleanor, 80 years old, whose family described her snoring as legendary, something everyone laughed about at holiday gatherings. What wasn't funny was that Eleanor had started falling asleep mid-conversation, and her heart had developed an irregular rhythm called atrial fibrillation. After evaluation, we found a connection between her untreated sleep apnea and that irregular heart rhythm. With treatment for both, guided by her cardiologist and sleep specialist, her energy and her heart rhythm both improved. Eleanor's case is why I take this 8th sign so seriously, because what looks like a harmless quirk can sometimes be tied to something the body has been managing silently for years. So let's bring this together. The 8 nighttime warning signs are waking up gasping for air, chest pressure or unusual nighttime discomfort, sudden shortness of breath while lying flat, frequent nighttime urination, unexplained night sweats, one-sided leg swelling or severe calf pain, sudden confusion, slurred speech, facial drooping or vision changes, and loud snoring paired with overwhelming daytime fatigue. I want to remind you, noticing one of these symptoms does not automatically mean you have a serious illness. Every patient is different, and there are harmless explanations for many of these signs. But when a symptom is persistent, worsening, or simply doesn't sit right with you, that instinct is worth honoring by having a conversation with your physician. You know your own body better than anyone else does. If this video helped you understand your body a little better, I'd encourage you to subscribe for more evidence-based senior health education, because I make these videos regularly to help you and your family stay informed, and I'd genuinely love to hear from you in the comments. What health topics have you been curious about, or what would you like me to cover in a future video? I read through them, and your questions often shape what we talk about next. I'm Dr. Alan Mercer. Thank you for watching, and I'll see you in the next video.